Calling the roll, Mr. Schron.
Here.
Ms. Conwell. Ms. Conwell is absent at the moment. Mr. Jones. Mr. Jones is absent at the moment. Ms. Brown. Ms. Stevens. Ms. Stevens is absent at the moment. Ms. Simon is absent at the moment. Ms. Baker.
Here.
Mr. Miller.
Here.
Mr. Tuma.
Here.
Mr. Gallagher. Council President Brady.
Here.
You have a quorum.
Thank you very much. Do we have anybody signed in for public comment?
We do, Mr. Chair. The first speaker is Dr. Leslie Koblenz. You'll step up to the microphone and you have 3 minutes.
Good afternoon. Welcome to the committee.
Thank you. Good afternoon, Council President Brady and distinguished council members. I'm Dr. Leslie Koblenz. I currently serve as the Chief Clinical Officer Consultant at the Adams Board of Cuyahoga County. I want to thank you very much for allowing me to have the opportunity to speak to all of you about the importance of housing and the impacts on health outcomes for individuals who have mental illness. It's very important to realize that the World Health Organization actually defines the social determinants of health as, quote, the circumstances in which people are born, grow up, live, work, and age, and the systems that are put in place to help them deal with illness. Housing is a basic need, and I'm hoping that I can assume we all had a place for our housing last night, but so many people don't. And housing is a prerequisite for meeting a person's physiologic and psychological needs. Therefore, unmet housing needs can have a very profound impact on both a person's physical needs and their mental health outcomes. When housing is not available, as can happen often, mortality rates of individuals and adults living with mental illness can skyrocket. According to the National Center for Healthy Housing, compared to the general U.S. population, a person who is homeless with a chronic mental illness has 3 to 6 times more likely to become ill. Their hospitalization rates are approximately 4 times higher, and they are 3 to 4 times more likely to die at a much younger age. Unstable housing can disrupt both medical and mental health care, and therefore disturb social service networks and available benefits. I'm sure you know when you've had to follow up on an appointment, whether it's for medical care, psychiatric care. If you didn't have housing, imagine how difficult that would be for you. The lack of stable housing can also decrease the effectiveness of mental health care because folks aren't able to store medications, they don't have the support system to take their medications, and they don't manage their medications well. When stable housing and assistance for housing is provided for adults who have mental illness, they're much less likely to use an emergency room. I would like to just urge you to keep funding the residential assistance program in Cuyahoga County. It keeps people in stable housing. It provides those individuals with supports for recovery and living with mental illness. And I urge you, for all these reasons, to please support the Adams Board request for additional funding for the residential assistance program. Thank you.
Thank you very much.
Mr. John Pico.
Good afternoon, Chair Miller and members of the County Council, excuse me. I would like to thank everyone for the opportunity that we have been given and hope that the information I am trying to convey is of some help with the decision that is to take place. My name is John Peiku, and with my wife and brother, we own and operate Madison Commons Group Home. We provide safe, secure housing for people with some kind of mental illness. If not for housing such as ours, most of the people that we cater to would be homeless, incarcerated, or hospitalized. The money the Adams Board provides so that people we serve have the safe living environment is without equal. When one considers the average cost per hospital day is close to $4,000 and a month in jail is $2,500, the housing money the board spends is money well spent. For as long as people were blessed with common sense, they looked for shelter. Without safe housing, there can be no stability in the life of anyone. Over 25% of homeless people have some type of mental illness. 13% are from abusive families, and 12% are veterans. I hope a house is the key to normal life. A normal life represents self-sufficiency, which in itself represents a productive member of society. The Adams Board and the money they provide for the homeless population is part of an equation that is successful, and again, without this money, these people would have nowhere to go. Housing like ours provides supervision, understanding, and most of all, compassion for these people that were forgotten, abused, or neglected by the society we live in. A warm meal, a clean bed, a roof over someone's head, like a veteran or a person with a mental illness, should not be a negotiation, but the right thing to do, because any one of us could end up where they are now. Thank you for increasing your investment in the behavioral health services, and again, thank you for the opportunity, and may God bless everyone.
Thank you.
Mr. Rick Oliver?
Good afternoon, Chair Miller and members of the City Council. My name is Rick Oliver. I have served as the Director of Crisis Services at Frontline Service for over 15 years. Through funding from the Adams Board of Cuyahoga County, Frontline has operated the Mobile Crisis Team and Behavioral Health Crisis Hotline for over 20 years. Today, you'll be hearing from the CEO of the Adams Board, Scott Osicki, who will be speaking to you about additional funding for crisis services in our county. I'm here to strongly support that request and would like to share some brief information with you about our services. The Mobile Crisis Team and Crisis Hotline are available 24 hours a day, 7 days a week. Our Mobile Crisis Team is staffed by licensed counselors and social workers who outreach into the community. We meet with individuals and we assess their needs, and we then connect them to the resources they so desperately need. We respond to calls from anyone, from family members, friends, employees, schools, as well as the individual experiencing the crisis themselves. Our crisis staff are trained to assist adults in crisis, as well as children and adolescents who are struggling with mental health and traumatic issues. Last year, we received over 16,000 calls for help, which was the most we've ever received in 1 year. And we met with over 2,300 individuals who were experiencing a crisis. The most recent numbers from the National Alliance on Mental Illness documents that 1 in 5 adults and 1 in 6 youth living in the United States experience a mental health disorder each year. Research also tells us that as many as 50% of individuals who are having a mental health issue are not currently receiving treatment. That equates to over 100,000 people in our county with an untreated mental health issue as I talk to you today. The barriers to treatment for these individuals include stigma, cost, access, and not knowing how to get services. Many of the individuals who do not reach out for our services end up calling the police or showing up in emergency rooms asking for help. Police cars and emergency rooms are not typically the best place for people suffering with a mental health crisis. Over the past 20-plus years, our face-to-face crisis services have helped over 50,000 people in Cuyahoga County. These individuals suffer from a wide range of behavioral health issues such as depression, anxiety, mania, psychosis, substance abuse, and suicidal thoughts. Despite our outreach efforts and innovative services, over 200 people died by suicide in our county last year. It's the highest number since 1985. It's clear that we must do more to reach these individuals who are in so much pain that they're ending their lives. We must increase our capacity to respond to those in crisis and who are struggling with mental health or substance abuse issues in our county. It's a matter of life and death. I thank you for listening to the Adams Board request for funding today. Thank you.
Thank you very much. Anyone else?
Yes, the final speaker, Ms. Liu.
Good afternoon. Welcome to the committee.
Good afternoon. I'm glad to be here, and also I'm maybe the last person for public comments, but definitely I would like to be the first person in the group to support our Adams Board. Adams Board has been offering lots of things more than the three people before me talking about. I remember 2017 when we had the budget hearings, our board president actually mentioned that the OEM crisis is outrageous. And we realize right now the one we are facing is from lots of painkillers also. Adams Board right now has a pilot program to use non-synthetic methods to help people to defeat the side effects from their own mental health issues or the side effects from the medication they receive. For example, acupuncture. That's the reason why it's very important. I wish not just the county council members will support Adams Board, if possible, even increase the funding for whatever they request right now. Because lots of pilot programs really need to come up, because Adams Board has been working really hard, not just for today, not just yesterday, and also for tomorrow in the future, to help everybody. Without a stable mental health into a control, your physical health also will get worse. And of course, your job stability and housing stability will also be affected. Not only existing homeless people need help, the working poor class, even the middle class, if they do not understand the importance of these things and start coming out to check out their own health, we will have way more people in trouble. So please support our Adams Board. Thank you.
Thank you very much.
That's it.
Okay. Next on our agenda is the one matter referred to the committee. Please read the resolution into the record.
Resolution number 2019-0224, adopting the 2020-2021 biennial operating budget and capital improvements program and declaring the necessity that this resolution become immediately effective.
Thank you very much. And we're going to use the same questions that we used in the last session that Trevor McAleer prepared, and encourage the presenters to fold the answers into their presentations. The questions again, number one, is the staffing level in your department the same as in previous years? Could you use additional staff, or could you get by with less staff? Second, what additional funding requests did you make for this budget, and were any approved and which were denied? And third, if we had a Health and Human Services levy increase, what are the top 3 areas you would provide additional resources to? And the questions are on the podium in the presentation area. And first, we are going to call up Mr. Scott Osicki to present on behalf of the Adams Board.
Good afternoon. I'm Scott Osicki, the CEO of the Adams Board of Cuyahoga County, and I want to thank Council President Brady and all of council members for allowing me to speak with you today about the calendar year 2021 allocation to the Adams Board. First of all, I have to say that we're grateful that the budget that County Executive Budish submitted to the council does not include a decrease in funding to the board. However, this funding has been stagnant since 2014. I also want to mention that through a partnership with County Executive Budish and Council President Brady, the Adams Board was allocated about $10 million from the first of the opiate lawsuit settlements, for which we are extremely grateful. This money, although one time, helps us fill some of the gaps in addiction treatment and recovery supports for the time being, and we are looking forward to a continued collaboration with future settlements. In June, I requested that the council increase the Adams Board allocation by $7.8 million and make that part of the board's base funding from the Health and Human Services levies. It was suggested by some that the council, it was suggested by some that we could reallocate funding from the lawsuit to meet the needs of the request. I wish I could, but we're using that funding to expand much-needed services. However, I'm standing before you today to lower my original request and ask for $5.1 million in additional funding to enhance our services for mental health, especially for crisis and housing for individuals living with mental illness. For the crisis services, we're asking for $2 million in additional funding to bolster our crisis services provided by Frontline, specifically the 24-hour suicide prevention, mental health, and addiction crisis information and referral line, and the mobile crisis team. This is an urgent ask as Cuyahoga County has seen the largest number of deaths by suicide since 1985, with 200 lives lost in 2018 and more than 194 deaths so far this year in 2019. It's important to remember that crisis services are available to every resident of Cuyahoga County at no cost. The $2 million in additional funding will be used to restore a $1 million cut made by a previous administration in 2018 and support and increase the workforce of Frontline to ensure adequate staffing levels and competitive salaries to retain crisis workers. Because of inadequate funding, Frontline has been unable to attract and retain crisis staff needed to meet the rising needs of the community. The increased funding and staffing would allow nearly 1,000 more individuals to receive crisis services and assessments in person, via the phone, or via the chat line. With just 20 crisis workers, Frontline has answered over 16,000 hotline calls and provided over 2,300 in-person assessments. At this time, many individuals may wait up to 24 hours for that assessment, which is far too long in the midst of a crisis. It's a very demanding job. Workers are out in the community, often in someone's home, at all hours of the day and night. The $27,000 to $35,000 annual salary of crisis workers is well below what it should be, considering the amount of stress that comes from making life-saving decisions and assessments. Regarding our residential assistance program, I also asked Council to consider providing $3.1 million for that program, which is also known as RAP. RAP provides $1,100 per month per client for room and board at adult care facilities or group homes, and $200 in spending money for clients while they wait for other federal and state benefits. Housing is a basic need, and without a place to call home, clients are living in the streets, in shelters, and are moving in and out of homes of friends and family. No new clients living with mental illness were able to utilize this program to obtain housing through the board's program because of cuts made in 2018. To ensure the Adams Board dollars are spent responsibly and that clients reside in facilities with a high level of care and comfort, we developed the Peer Seal of Quality program. This program uses peers to do a review of the homes to look at upkeep, cleanliness, and amenities in the home. They also look to see that medications and food are stored safely and that there's enough food and supplies for the residents that live there. Additional funding for this program would be used to restore the cut and reopen the RAP program to serve approximately 200 more new clients living with mental illness. And in closing, I'd like to thank you for your consideration of this request, your commitment to behavioral health, and your confidence in the Adams Board of Cuyahoga County. So I know you had these particular questions. The one, is the staffing level in your department the same as in previous years, and could you use additional staff? So yes, the answer is it's the same, or actually below where it was last year, because we've done some reorganization, our table of organization. But there are a few spots that we still have open that we're actively looking to fill, as well as there may be a creation of one new spot that I'm still contemplating. If they're approved, these are the additional requests that we're making. And then if we had a health and human levy increase, what are the top 3 areas that provide the additional resources? So one would be, of course, crisis services. The other would be the housing services. And then also, because the opiate epidemic is still going, that would be our third.
Okay, thank you very much.
Okay.
Questions? Ms. Conwell?
Through the chair to Mr. Osiki, in the RAP program, the state cut back how much on that did they have any cuts in terms of that program?
Well, they have the state supplemental program. They haven't had any cuts in that program, but the amount of money that's in there doesn't go very far. So once they open the program, it's closed within a matter of months.
Okay, and what is that they put in for that?
I am not sure at this time, but I could get you that information.
Okay, and so on an average, how much would the rent be to cover per person, I guess, for the 200 new clients, or what you pay now?
Right, it's is it $1,200, $1,100 per month plus the $200 in spending money.
Okay, so that's around,
So that's how we figured out the
Around
200
13?
additional clients.
Okay.
I'm sorry,
okay, so that's around 1,300 that you
Yes, per
spend on
month.
each client?
yes,
Okay, and you want to increase it up to 200 more new clients, correct?
correct.
How many clients do you have in there currently?
There's about 198, 200 now.
198 to 200?
Yeah, it's 198
Okay,
that we
so
have right now.
you're looking to increase to 400
Correct,
family? Okay.
correct.
And are these single adults or families or a mixture of both?
They are single adults,
Single?
yes.
Okay. Males and females?
males and females.
Is there an age range or?
It goes all the way up from 18 all the way up to people, seniors.
Okay, thank you.
For the record, Ms. Conwell, Stevens, and Simon are now with us at the meeting. Further questions? Councilman Tron.
Thank you, Mr. Chairman. You had alluded to the opioid settlements coming your way as far as in your organization, Mr. Osiki. Were you planning on receiving any of these opiates specifically before they were presented to you from the county executive?
I'm sorry, I don't
Were you
understand.
planning on receiving funds from these settlements?
We were hoping to receive funds from the settlement.
And what was the number or dollar amount you were hoping to receive?
For this first round, it was about 17.5 million that we requested.
Okay, that's without knowing what the settlements were, because we didn't even have some of those.
No, it was regarding the first two settlements. and
Okay,
county
so
had
after the
the
settlements
$23
came in, you
million.
were requesting
0.5 million.
0.5 million of that.
Out of this round of settlements, yes.
Okay, and I thought you alluded to that 17.5 request was built in your budget, of which you're receiving what, 10 million? Is that?
That was not built into our budget. These were for additional services that would be used for.
Okay,
So
and
we're getting around $10 million for new services. We're expanding residential treatment, and we're also bringing peer support to most of the hospital emergency rooms in Cuyahoga County.
so you're building them into a new budget, is what you're doing, the $10 million.
Yes.
I mean, it's either in a budget or it's not in a budget, so it's.
Right,
it's-
yes.
Yeah.
Well, no, it's not it's not in our base budget at all.
No,
This was
but it's a
additional
new
funding.
It's additional funding that you're building into a new budget program with new items that are going to be one time only. Is that what I understood?
Right now, it's one time only.
So when you're putting these new systems in, and it costs $10 million, you're telling us that next time's budget is going to have a gap because you will now put these systems in, and if there's not a one-time activity, you're going to be asking this body for $10 million to cover what our new system's being put in for this one-time activity.
Not necessarily, no. What we're doing is we're going to be monitoring those programs to see for their outcomes, how many people they're serving, and what happens to those folks. And then that way, we're hoping that we would have sustainable funds moving forward, especially from the opiate settlements that are yet to come.
Okay, so you're building everything on the drug settlements down the road, as far as programs you're putting in place by spending the entire $10 million with this activity?
Yes.
You're not saving any for future programs or anything of that nature?
No, there's no, because we don't really have any reserves. We don't have a lot of reserves, so it is not being used to supplant or make up for any other programs. These were new programs, and like I said, that we would evaluate them, and going forward, depending if those programs, we may reduce other programs to continue those, but we are hoping for additional money coming forward.
The suicides that you referred to, the 211
Yes.
for last year and the 194 for this year, how many of those are actually drug-related, opiate-related deaths?
No, these are suicides. They were labeled as suicides. I don't know if they were. No, I don't know if they were by a purposeful overdose of heroin or opiates. I don't know that.
Is that readily available, that
these were
information?
from the coroner's office. The medical examiner is the one who rules things as suicides.
Right.
By hanging, by gunshots, and things like that.
But there's no correlation at all that...
The opiate deaths aren't counted as suicides.
Okay, all right. Thank you.
Yes.
Thank you very much. Looking at the state's budget, there was a significant increase to the Adams Board. Do you know how much of that the county is expected to receive?
It really wasn't a significant increase to our Adams Board. What they did was it was for the entire state. So we basically received like the same amount of money that we did last year. What they're doing is taking that money and using it for specific programs. So once they allocate that money to us, we would be able to use it for the programs that they want us to. Now, one of them is crisis, but it's for crisis infrastructure. And they have not made any decisions on that yet because they're going to host a crisis academy where the communities all come together down in Columbus and come up with ideas and what would be best. But that's one-time money also for that. And they want to use that for infrastructure.
Okay, because it went from $5 million in 2019 to $21 million to 2020. You're saying those are going to be earmarks for specific programs.
Yes, correct.
And not a significant portion of that is not coming to Cuyahoga County.
We don't know yet because
okay,
they're still making
unclear.
those.
Okay,
right.
All right.
And they're for specific programs that they want us to spend on.
Okay, that's helpful. Thank you.
Thank you.
Councilwoman Simon.
Thank you, Director. I wanted to ask about the treatment beds that you're envisioning after hopefully receiving the opiate settlement money that's already been
Yes.
discussed. Are these where would these treatment beds be? And
Yes.
are you expanding existing places, or is it brand new?
No. So the beds will be expanded at Stella Maris. So what they're doing is they have sort of like recovery housing for men and women in a dormitory setting. They're taking those beds offline, and they're going to have a contract with Y-Haven to move those folks there. And that is and they'll have transportation back and forth to their expanded partial hospitalization program as well as their intensive outpatient treatment. So then they are converting those beds into residential treatment beds, which is what the community and what the community says that it's actually needed to help folks with getting opiate recovery from opiates and heroin.
How many additional residential treatment beds?
May I ask? I think it's 16, right? 16 women and 16 men. It's 32 beds. 32
and what's
additional
the
beds.
average length of stay that will be available for the recovering?
Right. It'll be variable from 2 weeks up until 3 months, I think, that they could stay there. Yes.
Okay.
And then they get moved down to then, the IOP and the PHP.
So I want to go back to your request for the crisis funding. And I know you said this was cut under the previous administration, that there was $1 million.
million cut.
Million.
Yes.
So if this were to be restored, do you have the capacity and the program basically in place waiting to be funded? Or is this going to be a different use of funds for the
It would
crisis?
be the expansion of the existing program they have. So like if they only have 20 crisis workers now, they would be able to expand the number of crisis workers that they actually have, as well as pay them a living salary for what they have. And that would be, Frontline would be able to retain and attract workers for this very stressful job.
Is this
Frontline is here.
spike in crises and suicides, is that is it consistent, or is it maybe reflective of the opiate crisis that it's spiked now? Or what's going on with the trends with this? You said it was a bad
Yeah, it's
couple.
been bad since 1985.
Is
Exactly,
that
it's the worst.
consistently bad? I guess that's my question.
It's been going up consistently during that time, but this is the highest that it's been since 1985. So it was 1985, then it went low, and then it's been gradually building up. But a lot of it has to do with the stressors of people's lives that they have, not necessarily related to the opiate epidemic at all, but just if people lose their jobs. And a lot of things is that it's middle-aged men. So whether they're losing their identities when they're maybe being downsized or retiring and things like that. So a lot of it has to do with that, as well as just their living situations. And then Rick Oliver will be able to answer that even better, because he is seeing what, the calls that are coming into crisis. And we're part of the Suicide Prevention Task Force. We're one of the leads on that here. And it's a group, community group coming together as to see what we need to do to alleviate some of the suicides.
Thank you.
Ms. Baker.
Thank you, Chair. What is your funding specifically now in the budget without any opiate ask?
Is $39 million.
And is $39 million specifically just for treating those with drug addictions?
No, it's treating all mental illness
So
and a drug addiction.
What is your drug addiction specific dollar
I think it is.
out of the $39 million?
I could give you the exact amount later, but I don't have that. But we spend more money on actually mental health than we do on addiction in our last annual report. I'll have to get that to you. But we've tried not focus on mental health as well as the opiate treatment as well.
So of that $39 million, you don't really know right now what percentage at least you're spending on opiate?
Maybe around 30%.
About 30%?
Yeah.
Do you think that 30%?
Beth, can you look up our annual report? Yes. Okay, thank you.
Do you think that the 30% that you're spending currently on addiction, there would be an overlap of services that you'd be receiving now through the lawsuit dollars that, I mean, people aren't compartmentalized. They usually have a multiple of issues, and I would think that you would find some duplications in their needs of whether it comes out of the existing 30% or whether it comes out of the new money that you're asking for.
The new money that we're asking for is for new services. It's for expanded services. What I think you're asking is about dual diagnosis, people who are living both with mental illness and addiction.
No,
Right.
I think that you would find, that the people that you're going to be giving these new services to are also going to be needing the old services also. That beyond the residential assistance, they're probably going to have needs that you're going to be giving them out of the budget that now exists. And I'm just asking, do you think that there would be times when you would have overlaps of residential assistance program and treating the opiate addiction?
I'm sorry, I don't follow. So residential treatment is one type of treatment. After they go to residential treatment, then they can go to partial hospitalization programs or intensive outpatient programs. So
You don't think there's any overlap between what you give them to help them with their drug addiction and putting them into a new program of residential assistance? You don't think that that person who has been treated,
okay,
right, would need
some more residential treatment.
or more opiate assistance that perhaps would come out of your residential assistance program because they're
Oh,
not.
the RAP program, I'm sorry. No, those are two totally different things. The residential assistance program is for people living with mental illness. It has nothing to do with opiates.
Okay. All right, let me review my question and continue.
Councilman Gallagher.
Is there any state money flowing from the budget to Cobb County regarding opioid assistance? Because I know it was one of the main platforms of the governor.
The governor, yes. It'll be for specific programs that we have to use it for. And I don't know if all the decisions haven't been made yet about how much funding that we would be receiving from the state yet. They're doing it in individual programs.
Right.
So they're still
It's going to
working
be
on that.
substantial.
I don't know if it's going to be substantial because when the amount of money that they put in there, over 88 counties that we have, it really doesn't add up to that much additional
I think they're
money.
going to target the hot spots, and unfortunately, we're one of those.
We hope that they do, yes.
And I think some of the line of questioning you're seeing is people are spending money we don't have yet on these settlements, and the settlements are specifically for opioid
Yes.
assistance programs and really shouldn't have a bleed into other areas, and the court's going to have a say on that. So there isn't an assumption that you can go left or right. We're going to have to stay center on opioid assistance programs specific.
I'm sorry, sir, but the $10 million that we're getting, I'm led to believe that has already been settled. That money is coming, the 10.1 million that we have, or the 10 million.
Specifically for
Yes, opiate addiction
opiate
programs.
addiction
Right, and that's what we would
programs.
like to use it for, yes.
And, throughout all this, I mean, again, the governor, this was one of his platforms.
Exactly.
When he was Attorney General, he was very helpful to Cuyahoga County with money from the state to help us back then. So I would suspect that we're going to be in a good spot, but I just want to stay focused on those programs because this isn't going to go away soon.
Right, I agree with you, yes.
So,
I have the question, I'm sorry, sir. Beth, I can't open your phone back up. About the percentage, I forgot who asked about Nan, yes, Councilman Baker. So 19.5 million is spent on addiction and 42.7 million is spent on mental health.
42 and what was the 42 and
17?
17?
19.5.
19.5, okay.
Yes. And the mental health treatment is more expensive than the addiction treatment. Plus, it's a more long-term treatment for life mental illness.
Ms. Brown.
Thank you, Councilman Miller. I guess the question relative to the state programs, I understand that is going to be determined at the state, and they're still making those decisions. But was it a competitive process, or is it just an allocation? Again, according to the need, how have they given you any indication on how those dollars will be allocated?
They're making the determination. So I don't know the exact criteria they're using, and we've been asking that for a long time, but this is a new administration.
Right.
So I don't think it'll be a competitive process. I think it'll be based on the need of each individual area.
Okay, well, that's also
Yeah.
helpful.
Yeah.
Thank you.
Yes. And if I could, Felicia, I may ask a question, sorry. Felicia, right? Because we haven't received any new money yet for opiate treatment, right? And really not for mental health either, right? Our budget is basically the same as it was last year, but they'll be giving it to us later in certain increments. And like I said, the crisis one will be based after they have a whole statewide meeting on that, and that will be for infrastructure. Yes.
So, Director,
Yes, sir.
you said that you would reduce your request for increased funding from an original 7.8 million that we heard a couple months ago to 5.1 million.
Correct.
My question is this because of some of what you were requesting you're now funding with the opiate money, or did you delete some items out of your request? And if so, what did you delete out?
We deleted out of the request was more funding for opiate treatment. One was specifically for sober housing, that once a person, after they go through residential treatment and the IOP, a lot of times people cannot go back to their regular homes, their regular home life. So they live in sober environment that allows them to continue on in their recovery and get them training for perhaps new jobs or education until they're long enough in their recovery that they could go back to where the communities that they were living.
So the money that you backed out of your request was opiate money?
It was, yes.
Okay. The $10 million that you received from the opiate settlement, over how long of a period of time are you planning to spend that money?
In a year or until it runs out. So what we've done is we based it on a year-long budget with Stella Maris and also with the group that would be providing the peer support services. But like I say, we'll be monitoring those to make sure that we're having effective programs that are working. And we would have to go back, after that year or whatever, to see what we could adjust our budget to continue those programs or lessen other types of programs.
You mentioned there being cuts in 2018. Can you say more about who made those cuts and what was cut?
It was just our previous administration at the Adams Board. So at that time, it was Valeria Harper.
So, but I presume that she cut that money because somebody else cut funding.
I can't answer to that as to why it was done.
Okay. I remember a couple years ago we kind of we got involved, you got involved, the city of Cleveland got involved, and some additional detoxification beds were created. My question is, have we been able to maintain that level, or did we have to close some of those beds because it was only temporary?
No, we maintained that level.
Okay. And the detoxification beds that are used for alcohol addiction, can the same beds be used for opiate or other drug addictions, or are these two separate systems?
No, it's the same.
It's the same.
Yep,
Okay.
the same beds. Yes, they serve detox for people with alcoholism or drug addiction.
Okay. And do you have some sense of the latest statistics on opiate fatalities, whether it's so far year to date, is it increasing, decreasing, or staying about the same?
And from the medical examiner's office, it's starting to increase again. Remember, we had a very slight decrease.
We did.
And then it came back up. And a lot of that is because now that the drug dealers are putting fentanyl in crack cocaine. So it's opened up a whole new market of folks, if I want to say it that way. People who didn't know that they were taking heroin, fentanyl, that they were passed away with that. And then we also hear that down at South, and it's also moving up here now, they're putting it in marijuana as well. So that's why we run our test strip program, and about $45,000 a year for the test strip program, and it's distributing 45,000 fentanyl test strips to people. We're not promoting drug use at all, but what we want to do is promote saving people's lives, harm reduction. So people are able to use those test strips to test whatever drug they have to make sure that there's not fentanyl in there or heroin in there, and they would be able to make an informed decision of not using that. But we want people to have the ability to be alive so they can make the decision to get treatment. And especially with the crack cocaine now, they didn't know that that was in there at all.
And how long does it take for someone to detox from opiate addiction?
It's usually, is it 5 to 7 days? I will ask Dr. Leslie.
Yes, correct. 5 to 7 days.
Yes. And sometimes longer, yes, depending on how far they are in their addiction, correct? Yes.
Other questions, Ms. Baker?
Yeah, just to kind of put in line here what it is that you have and what you're asking for. The $39 million that you currently have, if 19.5% of that is spent on the opiate services, say it's 20%, that would be about $8 million. What you're going to be receiving in this first round is $10 million. So you have well exceeded what you're receiving for the new dollars and what you have right now in your budget, just so we can understand, with probably more dollars to come.
Yes.
Is that, that's how you're planning your program, is understanding that the huge influx of money well exceeds what you're already receiving in your budget, and you have planned for that?
Yes, we have, yes.
Okay.
Council President Brady.
Thank you, Mr. Chairman. Just a few comments. First of all, thank you for all the work that you do. You folks have been around officially, I guess, for 10 years.
Yes,
and the council has worked with you for at least his last 9 years. Sometimes very well, I would say sometimes not as well as I think we should have. But to you would agree that that the opioid money that you're going to receive, the $10 million, is for additional services. It's not to backfill your budget, but for additional services. And the point of the county receiving money is because of the opioid crisis, to do something about do something beyond what we're doing presently. So it's not a matter of replacing your budget with opiate money that is new, but to be able to have to raise the level of services, and beyond that, we know, for those who might think that that this level of funding would be something that we would be able to sustain. That's assuming that this opioid crisis is never going to level off or decline. Our point, or part of, as I see it, our point of spending so much money on this issue is to try to make a dent in it, to try to stop it, to try to slow it down, to try to turn the corner on it. So our hope is not to build a permanent, sustainable opioid program as if we're going to have a permanent, sustainable opioid problem. We don't know what the future is, but our hope is to defeat this epidemic, not to prepare to live with it for the rest of our lives and everybody else's beyond us, correct?
Correct, yes, very well said.
All right. So the additional funding that you're asking for is not associated with the opioid money, but associated with what you believe should be the base budget of the Adams Board in order to provide services in the community.
Correct.
Correct. All right. All right. Thank you very much.
Thank you, sir.
Ms. Conwell is next.
Through the chair to Mr. Osiki, going back to Michael Gallagher's point and Mr. Brady, out of the $10 million of opioid settlement, what specific programs are you planning on using the settlement funds for? And do they include any prevention programs?
At this time, there's no prevention, but we would definitely be looking at that moving forward. Right now, it is increasing the 32 beds, or making new 32 residential treatment beds at Stella Maris, and that's about $5.7 million for that, as well as they're expanding their partial hospitalization program and their outpatient intensive treatment. Also, St. Vincent Charity Hospital, $2 million to them, and that will be for expanding their partial hospitalization programs and their IOP programs, and still some other programs that we will be meeting with them about. And the remaining amount of the fund will be spent with Thrive ED, and that's a program that we're expanding now from Metro Health that would be expanded to as many as many ERs in the county to have available. University Hospitals is already committed, as well as Cleveland Clinic. And what that is having a peer support person available, one or two, available 24 hours a day per ER. So when a person is revived from their overdose, this person would be able to talk to them. They would be able to advocate for getting into treatment. They would be able to take them to detox if that's what they want to do right away. And they would also be able to follow them through their recovery process. So a peer recovery support coach. And then that's a new kind of, it's not really a treatment, but it's a way of using people with lived experience who are living in recovery with addiction to help other people live in recovery as well.
Do you have a cost breakdown for each?
Yes, I do.
Okay,
Yes.
could you provide that to
Yes.
us? And of course,
Yep.
the 4 or 5 that you mentioned, I only got 3.
Yeah.
Thank you.
Yeah.
So I would say that the Thrive program is a prevention program because
Okay.
an awful lot of the fatalities are going to occur after multiple events, and if you engage with people after the first event and get them into effective treatment and so that they don't have any more, well, that's going to prevent fatalities. So
Okay. Thank you for that. Yes.
Ms. Simon?
As a follow-up to the Thrive In program, are there statistics how effective these coaches are?
It's a very new thing that's just started. So that's why we have promised the county that we will be tracking that to make sure that it is an effective program.
New here or new? Are we the first? Or I'm sure there's programs elsewhere
Yes,
that
and-
adopt
and-
this.
Yes, and others as
coaching.
well. But it's all new within the, I would say,
On the same-
Dr. Leslie, what do you think? Within the past year or so, right?
1 to 2 years.
Yeah.
But they have been proven very successful in other areas of mental health.
Yeah.
So I think
In mental health, yes. But the AOD is sort of a right, new, yes.
and I think a lot of AA is built on peer
I'm sorry, Leslie, can you come up? Dr. Leslie, is that okay, counsel?
Yes, go ahead.
I think a lot of
Could you
AA.
please
Say your name again.
give us your name for the record?
Dr. Leslie Koblenz, Chief Clinical Officer, Consultant of the Adams Board. A lot of AA is built on peer support, helping each other through the crises, and a lot of addiction treatment is built on peer support. So we have every reason to believe that this will be an additional help to the community because emergency rooms can't do it alone, and this is an important piece that we're going to be putting some effort towards.
And from where do you find these coaches? Is it recovery court graduates? Where do you?
The state offers peer recovery coach training, and it's a certificate program that they go through. And after that, once they get approved, there's also continuing education training for them. So it's from the state. That's where the peers come from. So they come from local community, people who are living in recovery. They apply, they go to the training, then that is how they become certified to do it.
For the record, Vice President Jones has now joined the meeting. Any other questions for Adams Board? Councilman Stratton.
Thank you, Mr. Chairman. One of the comments, at least I thought I picked up, is that you've received the 10 million, and so that's a done deal. But this body has an obligation to report back to the court as to how every penny is going to get spent.
Oh, yes,
And so
sir.
that's why we're asking these questions. It's not a done deal. We'll be asking these questions with a lot of scrutiny as far as how those opiate dollars from the settlement come through, how they're getting spent. I was concerned that you said there was no prevention, but yet the council president alluded to sounding like it's a prevention is where we're trying to go with this, and yet I know the questions from the chairman brought it back to at least one element of prevention. The other one sounds like their infrastructure, beds and
No, they
rooms
already
and-
have those. They already have them.
But we're picking up the cost of those, yeah.
Well, yes, we're paying for the treatment services, yes.
Okay,
Yeah.
so that it sounds as though it's a new program that you're going to be putting forth as this goes in there. And I thought I heard the numbers was 42 million and 19.5. Was that the numbers I
Yes.
thought that came off the came off
About
of
our
there?
annual report, yes.
Yeah. So that's the mental and the drugs, and so with the $10 million, that's a 50% increase in just that one function,
Yes.
and you're going to spend all 50% in 1 year.
Or we based it on a year, yes, or until the money runs out. So they're going to charge us, they're going to send invoices to us for the people that they're serving.
For those three activities that you listed, basically,
Yeah.
where you're going to spend
Yes.
the new money.
Correct,
It just
of
does
this
not-
settlement, yes.
It just does not seem that you would spend a 50% increase in 1 year and then that you're not going to be building a permanent program at some point along the way. I just have watched this in the last 9 or 10 years. When government programs start, they don't seem to ever have an end.
Yes, we know that
And
from
you're-
SAMHSA grants and things like that, yes.
Right, so
Yes.
this body better be prepared when the opioid settlement dollars run out for us to be permanently funding these requests.
Not necessarily.
Okay.
Okay, because
I'll be
as-
from Missouri, I'll be honest.
Okay.
Just
Because
because I've watched how government spends money. It doesn't, last year's money you're going to come in and talk about budgets and expenditure because you have what, 61 million you spent? If I added it up.
correct.
So now
Yes.
we're going to be at 71 million, even though it wasn't included in a budget, which I always find it interesting. You're going to spend 71 million, but yet it's not budgeted. It's for these new activities.
It's budgeted for the new activities, right? It's budgeted for the new programs. Eventually, when we get additional funding as well, and we could do additional prevention programs, and that's hopefully like what Council President Brady is saying, that the opiate epidemic will not be as severe as it is now, and therefore some of those programs may not exist then in the future.
So you'd come back to this body and say, reduce us, please reduce our body by 10, 15, $20 million if you've received that.
No, because the $10 million is one-time money, and we understand that's coming in as one-time money. It's not part of our base allocation.
Okay.
I wish I could ask for $10 million additional in our base allocation, and then we wouldn't have to worry about asking for additional money to maintain programs. But this is one-time money that we're getting in. I'm not asking the council for permanent money except for the money on these programs that I'm specifically asking for, which is for mental health.
Okay, thank you.
Other questions? Thank you very much.
Okay, thank you, everybody.
Okay, our next presenter is the Office of Homeless Services, Ruth Gillette.
Good afternoon, Council. I am Ruth Gillette with the Office of Homeless Services. My presentation follows the memo that Councilman Miller sent out and incorporated the 3 additional questions that were provided. So I'll just present that. I have no songs, no poems, no raps today. I could do something if you really, no, okay, all right, we won't do that. So the overview,
I remember there was one year when you did it. Didn't you kind of present it in a rap?
I did,
Yeah,
two years ago.
I remember that.
Good.
That was was distinctive, but that probably good that was a one-time thing.
See that's what I was worried about, that in fact, while it's entertaining to me, it's probably not that entertaining to
It was
anybody
entertaining.
else. Okay.
It was entertaining.
Well, in that case.
Yeah, no, it's like one-time funding, that's all.
I could do a dramatic reading of Give Me Money. That, you know, the best things in life are free. You can give them to the birds and bees. I want money. That's what I want. Anyway, enough. So the overview of the OHS budget is projected to be very close to the 2019 levels of expenditures. As you will see on the budget, there's a 25% reduction in controlled services, which is, you know, kind of an internal adjustment, and then a 1.3% increase in contracts. The 2020 budget assumes a staffing level of 5 FTEs because it is anticipated that several current staff will retire in the next 6 months. The staffing levels will fluctuate while staff are being replaced, but that's not really reflected in this discussion. No programs or services were projected to be reduced or eliminated from the between the 2019 to the 2020 budget. There were no additional project funds were requested for the 2020-2021 budget period. There's an increased amount in the contract line that reflects $100,000 that were added to the OHS budget targeted to support cold weather shelter for persons who are shelter resistant. The three top areas for levy support, I just would like to provide sort of a discussion that the levy funds provide a basic safety net of emergency shelter and overflow shelter for single adults, families, and young adults. The levy in general supports facility maintenance and operations, including food and laundry, appropriate numbers of and skill levels of shelter staff, security, and staff training, among other things. The levy funds are leveraged with other federal, state, and private foundation funds to meet the community's needs. Dollars to provide rental assistance to help households leave shelter quickly are awarded to Cuyahoga County through the Department of Housing and Urban Development through the Continuum of Care competitive grant process. These funds cannot be spent on shelter, so the levy dollars are very important to maintaining our basic, safe, accessible shelter for those households in our community who are experiencing a housing crisis. I just really want to stress that shelter is not housing, and our goal is to move households from a housing crisis to permanent housing as quickly as possible, and to support housing stability through linking households with benefits and mainstream resources through the systems in the community that are charged with these activities, like Ohio Means Jobs and Job and Family Services. In the materials that were provided prior to the meeting, there is a chart that gives you some data on the number of persons and households that were served in 2018. And I'm happy to answer any questions that Council has.
Questions? Council President Brady.
Thank you, Director. Just wanted to ask you about the women's shelter and about how it's going with the YW and in general.
Okay. To the chair, to Councilman Brady. So in general, I think that things are going well at the under the YWCA's management of the shelter. Through the increased support of County Council, there's been a significant increase in the number of basic staff that are at the shelter, and also increased investment in clinical staff that are there throughout the day and in the early evening when there are clients there. In addition, the council supported funding for Eden, which manages the facility, and so there have been improvements in the building maintenance. Eden is doing some other investments, replacing mats, increasing the number of lockers, those kinds of things. In addition to the levy dollars, the Office of Home Services was awarded planning dollars through the HUD competitive process, and we have provided consultant services to the YWCA. Our consultants have been in town several times and are both providing direct online, line support to their staff, training, and also, support to the leadership of the YWCA around developing policies and implementing those policies and recommendations. And that's an ongoing engagement that we're able to maintain to, provide a continuous improvement environment there. So I think that while the numbers have not been reduced dramatically, I think we are moving forward in a way to really link the clients with permanent housing more effectively. So hopefully a year from now, we'll be able to see a reduction in the number of people that are staying there because we'll have been moving them into permanent housing more quickly.
All right. Thank you very much, Mr. Chairman.
Ms. Conwell.
Thank you. Through the chair to Director Gillette, you stated that there's 5 employees in the office. After the retirement occurs, has there been any conversations in terms, so I'm looking at that's, and just in our previous conversations, that'll probably put the office to 3. Are there any plans that you know of to get that to the 5 minimum, even though you've always said year after year 5 was not enough to do all that you do?
To the chair, to Councilwoman Conwell, yes, so the Director Parfiowicz has been very supportive of the fact that there will be staff changes, and so we have already begun to interview for one of the positions, and he's encouraged me to work with HR to post at least one of the other positions and actually an additional position. So we are moving so that there won't be a time when there's only 5 people, but that we'll be building on maintaining appropriate and maybe expanding staffing so that we will be able to meet the requirements of the office.
Before the new people come into that department, can you let us know how many do you think is an appropriate amount of staff that is needed for your department now?
To the council, yes.
Okay. You don't have that number today?
So one of the projects that we asked the consultants to provide was an analysis of the Office of Homeless Services as a continuum of care compared to offices, several other offices throughout the country that are comparable. There's really, no communities are really comparable, but sort of tried to match up. For example, like our continuum is one of the highest resourced continuums. We receive, 28 million from HUD annually, plus other funding. And so, looking at continuums that are also managing large amounts of money that are in urban areas. There were 2 that were also operated out of public jurisdictions. Most communities' continuums operate out of nonprofits. Anyway, I'm happy to share that analysis with you. Looks at the dollars, looks at the contracts, looks at staffing, and you can see sort of the different, it also looks at salaries, like what people are paid for operating those. So I'll email that to you all.
Thank you.
Ms. Simon.
Thank you. Just a quick question on one of the barriers to people seeking shelter would be if they have pets and they can't bring them in. What's the experience here that you've witnessed in terms of that being a problem or something that might need to be addressed?
Okay, thank you. To the chair, Councilwoman Simon. So that is not a barrier in our community. It can't be a barrier because it is covered by the Americans with Disabilities Act. If people have service animals, you're shaking your head.
What if it's not a service animal?
Okay.
What if it's a cat? Although there are service animals in and of themselves, but I'm talking about pets, not necessarily
pets. Okay.
service animals.
I'm sorry. Normally, when people say pets, I think of a service animal. So we do, our continuum and the shelters each have their own policies, but the continuum in general tries to follow ADA requirements, and we expect the shelter providers will as well. And so what that means is that they do have to have some kind of documentation that they are a service animal. We don't really, it's really not feasible for people to bring pets into shelter for many reasons.
Mr. Chair, to Director Gillette, I understand. So I'm asking, I guess I need to drill down with the provider to see if people are turned away if they come in with a non-service related pet and they don't go in because they have a pet and there's not another place for them to take them. And so they feel safe going into the shelter, seeking treatment, but yet they don't have to worry about leaving their dog or cat behind that doesn't qualify. That's another discussion, but I'd like to get some information on that here in Cleveland.
Well, through the chair,
Cuyahoga.
Councilwoman Simon, just to clarify, so people don't go directly to shelter, they come to coordinated entry. And so coordinated entry could, if it's a pet that doesn't have is not a service animal, could work with that family or that individual around finding an alternative place for the pet to stay while the person was in shelter. I know some communities have developed relationships with their APLs or other animal shelters to shelter animals while the individual is in shelter. So
we explore this further because we're in the middle of a budget hearing. But yes, that's exactly the information I'm seeking is when they go in for intake coordinated care, what is going on with these situations, which I'm sure exist.
Okay.
Ms. Baker.
Just quickly, in the past, we've always talked about the core service that you provide of trying to get people the services they need in a temporary situation and then trying to move them on into more permanent housing. So how have you done on that front? And would you say what the average stay is that you think is appropriate? I know all situations are different, but in a perfect world, how would you like to see women that come to shelter stay, get the services they need, and then move on to more independence? What kind of time would be a success for you to see that happen?
Through the chair to Councilwoman Baker. So HUD has, set a standard of that people should be in shelter. They should really be relinked with housing within 30 days. 30 days. That's their standard. Locally, we, and you have to realize that, the homeless system was moving from a standard where if you were a very compliant kind of client, you could stay for up to 2 years, in a transitional kind of program. So, getting the mindset to go from you can stay here for 2 years to let's help you move on as soon as possible. So our average length of stay for families is about 53 days at this point. And what that means is that from the time that someone enters shelter to the time that they leave the shelter into their own unit is about 53 days. But in order to even get to that metric, what we do is ask that the shelter refer people to rapid rehousing within 7 days of the time that they enter the shelter. But then it takes, then within 2 days after that, they're connected with a housing locator who will work with them to identify a unit in the community. The unit has to be inspected. If the unit fails the inspection, the landlord is given an opportunity to correct the deficiency, and then it has to be re-inspected. So, to actually, achieve that 30-day measure would be really very difficult. I don't know any community really where that's a reasonable expectation.
So it's not that the person who is in need and gets the services doesn't receive them and isn't ready to move. It's that we don't have the bureaucracy in place to get them in and out in 30 days.
To the chair, to Councilwoman Baker, I think hopefully it's not a bureaucracy. I mean, what we have is a process that everyone is we're looking at the metrics on a regular basis to make sure, for example, that people are being referred to, make sure that the housing locators are following up with the clients, that once someone finds a unit and signs a lease, that they actually move out. At one point, we found that people were signing a lease, Eden was issuing a check, but people were kind of hanging out in the shelter for another, however long. So, I mean, we're always kind of looking at like where are the roadblocks? Finding the housing is a big challenge. Eden has implemented a landlord liaison position that would continue to try to develop more landlords who'd be willing to participate in the program.
I guess the downside of a longer stay is that there could be those looking to stay and needing housing, and the room may not be there for them because the length of time to get those that are able to move on but haven't been able to because of the circumstances.
That's exactly correct. I mean, the idea is that if, looking again at the total numbers of people that are seeking shelter, the number of shelter spaces that we have, and having an idea of how long it takes to move people out, we can get a good idea of what's the capacity that we need. And if we can, help people leave quickly, then we aren't in a situation where we have to expand crisis beds because we have the capacity if people are leaving. So.
Good to know. Thank you.
Director, do we currently have enough shelter space for everybody who is homeless, needs shelter, and is willing to be sheltered?
To the chair. So we have enough shelter space because we have also an overflow system in place so that anyone seeking shelter is provided a shelter bed. And then, back to Councilwoman Baker's point, the idea would be to sort of, if we could increase the exit rate, then we wouldn't need the overflow. So, we're working on that. I know that you're aware of that there's people who are shelter resistant in our community who will not come into shelter. That does not prevent outreach workers from going out to continue to work with them or engage with them. Our permanent supportive housing program will move people who are shelter resistant, but who will accept housing, from a camp into a building, and that has happened, many times. So I don't know if that is what you're looking for.
It is.
Okay.
And am I correct that even though the economy is in some ways pretty good, that the number of homeless is continuing to increase?
Yes. So the National Low Income Housing Coalition does a lot of analysis of the cost of housing as compared to employment rates. And one of their reports pointed out there isn't a county in the entire United States where someone earning minimum wage can afford housing. What that means is that people who are low-income wage earners have to work more than one job in order to be able to pay their rent. And so, the metric there is that the assumption is that we all would pay about 30% of our income for rent. And if you look at all the options of housing out there, that at 30% of my income, I should be able to find a place to rent. If I have more income, I'll be able to, afford a better place to live at 30%. But if you have very minimum income, 30% of that income is not going to get you rent. And what happens is you end up paying 50 to 80% of your income for rent. And so when something comes up, you get sick, you can't work, your child gets sick, you can't work, someone dies, you want to go to the funeral. There's an interruption in your income and you end up losing your housing. And so it is very much an economically driven issue. And until there's federal interest in increasing subsidies, I'm not talking about increasing public housing or even the Section 8 voucher program, but actually a low subsidies based on income, we will continue to see people struggling to and experiencing housing crises.
Okay. You mentioned that in the overview that you have a 25% reduction in controlled services. That always surprises me. Controlled services relates to basic overhead of running an office, and it seems like that should be a pretty constant number from year to year. Can you explain why you have a 25% reduction in controlled services?
Councilman Miller, I cannot, but I mentioned it only because I thought someone would notice that it's, a pretty big reduction. You're right. I mean, it's those things that each department is allocated as a percentage, and I don't know what those formulas are.
We'll follow up with budget and management.
Thank you.
Okay. Anything else? Okay.
Thank you very much.
Okay. Next, we are privileged to bring forward the Director of Early Childhood and Invest in Children, Dr. Rebecca Dorman.
Thank you, Chair Miller, and I am Rebecca Dorman, Director of Invest in Children and Administrator of the Office of Early Childhood. Thank you for this opportunity to come before Council today and for your support of the work that we do. Your wise investments in building the brains of our youngest citizens have great and long-lasting impact. As you know, that's supported by lots of data, our local data, national data, showing what a great investment this is and what an excellent return on investment these dollars provide. This year, I'm proud to say Invest in Children celebrated our 20th birthday. Sometimes we take for granted the depth and breadth of the early childhood system that we built here. But I want you to realize that I get contacted all the time within the past month by St. Louis, by Toledo. I've been contacted by communities across the country in the 10 years I've been in my role to ask, how do we do it here? And so people are really amazed in other communities. Because we've been around for a while, we did want to revisit our mission this year, and so I'll get to numbers in a minute. I just wanted to read you the revised mission of Invest in Children. The mission of Invest in Children is to mobilize resources and research to ensure the well-being of all young children in Cuyahoga County. We provide a continuum of targeted services, prenatal to kindergarten, for children and their families, build awareness, advocate, and measure our impact. We aim to achieve equity in access to services and eliminate racial, ethnic disparities in child and family outcomes. So what we added really was the measurement of our outcomes. We felt it was really important to build in and emphasize our accountability, as well as calling out equitable access to services. We're extremely proud of the outcomes that we have achieved with our flagship UPK program. We know that children who attend UPK are much better prepared for kindergarten, both in terms of language and literacy as well as social skills. We have a mighty staff of 10 and also are delighted this year to have a public sector fellow with funding from the Cleveland Foundation. We know that we are making a difference in the lives of over 4,000 children in UPK, as well as 2,700 children who receive home visiting annually, over 800 who receive mental health services in their homes, and over 1,000 child care providers throughout the county who receive technical assistance and training to improve their quality. I also just want to make sure to remind you that about 4 years ago, we took over the management responsibilities of the child fatality review process for the county, and we continue to work with the Cuyahoga County Board of Health on producing the Protecting Our Future report every year. So moving on to our budget. It is really status quo. Our recommended budget for 2020 is $18,403,068. In 2021, there's a slight increase of $360,827, which is all in staff salary increases and those controlled expenses, those administrative chargebacks within the county that OBM assigns to us. We have no role in that. So this is flat funding, which will allow us to continue to serve children and families at the same rate as the past 2 years. There are no additions, there are no deletions. We are able to maintain the expanded UPK program, continuing to draw down both the public and private dollars in tandem. At our current spending rate, we're confident we'll be able to maintain the current number of children at the expanded level through the end of 2021 calendar year, but I'll have more to say about that in a minute. So that's really not a big story with our budget, fairly straightforward. So I just thought I would go into the 3 questions that you had asked us to respond to. Our staffing level, we have 10 full-time staff. That's consistent. We also have a business manager. She is actually part of the HHS Shared Services working within HHS, and she works both with us and with FCFC, with Family and Children First Council. We share her. We do believe we're at the appropriate staffing level. In terms of items we requested this year, but were not included in our budget, as I said, the budget was status quo. We had requested an additional $379,000 annually for the SPARK program. That's supporting partnerships to assure ready kids, a home-based early literacy program for 3 and 4-year-olds. Currently, the program is serving 230 children. The additional dollars we requested would let us serve an additional 70 children, and we are currently relying on grant funding to serve those children. We've been getting an array of patchwork of private funding for a number of years now, and we're requesting to be able to move from the private dollars to the public dollars. Happy to tell you more about that if you would like. And then moving on to sort of the 3 areas that we would improve with levy dollars, I want to come back to UPK. So while I did say that during this next budget, we do have enough funding to stay at current levels, during the budget period, by December of 2020, we will need to have a plan for sustainability if we're going to maintain the UPK expansion, because we will need to conduct an RFP in the beginning of 2021, because our program year is a school year and it will be starting in that fall. To maintain our current expansion, we would need an additional approximately $5 million a year, and that would begin in 2022. So we need a decision during this budget period. The actual dollars will be needed in the following budget cycle. Hope that's clear. We would really like to expand our newborn home visiting program. This is the one-time visit from a public health nurse from the Board of Health to families on Medicaid or who have another high-risk condition such as domestic violence. Specifically, what we would like to do is be able to offer the program to the 800 families who give birth at Hillcrest. We're not at Hillcrest now. We're at Metro. I should say the nurses are at Metro and at UH. And that is where most of the Medicaid births occur, but there is a significant number there is at Hillcrest that we would like to serve. And then lastly, I don't know if you want to hear about a computer system, but we are participating in the Office of Innovation and Performance's STIR program. If you've heard about it, Startup in Residence, where just yesterday RFPs went up. I think there were 6 from Cuyahoga County, including one from our office, to develop software to help us do a better job managing the UPK program, all of the invoicing, budgeting, scholarships, etc. So at some point, if a startup responds and starts to work with us, we may need some dollars to complete that project. We don't know, but that's something that we're excited about. We're hoping we'll get a lot for free. We'll see how it goes. And so with that, I'm happy to take your questions.
Thank you very much for the presentation. Ms. Simon is first.
Thank you so much. Great work you do with Invest in Children. And my question is maybe premature, but we're going to have to start talking about this. You brought up the plan or lack thereof to continue to keep the status with regard to the UPK expansion. And when that happened, I recall that there was a private-public relationship and private or nonprofit formed to, was that correct, to receive the dollars?
There was a fund created at the Cleveland Foundation, from which we pull most of the private dollars as they go into the fund from the funders, and then we make requests and pull as needed from that fund.
So I was here when that was created. Was there discussion at the time through the committee? I don't recall the answers about how that was going to be sustained, or was the concept to have a one-off and expand and then retract again back to where we were when we started?
I think what we were thrilled with the private fundraising and also, of course, for the public dollar set aside. And I think the plan was we needed to come up with a plan, that we had a number of years. We actually have one more year than we anticipated, but that we would need to figure it out. There was not we were looking, were there opportunities, state or federal? Elections have occurred, and it has become clear that that's not where additional dollars are going to come from specifically for our program. So I think it was really, we have some time now and we're going to need to work on it. And there is a Early Childhood Partnership Council. There have been discussions, but no decisions about how we can move forward.
And when you speak of we, is the we different than when this expansion occurred with the private donated dollars?
Well, I mean, the co-chairs of the Partnership Council have been the county executive and Paul Clark, although he's now retired. And then, we have yourself and Councilwoman Brown are on the Partnership Council, and an array of other funders and civic leaders. So there have been discussions there about what to do, but no decision yet.
Thank you. I mean, this is going to take some heavy lifting.
Questions? Councilwoman Baker.
Thank you. You're celebrating 20 years in early childhood Invest in Children. Is that right?
Invest in Children is. I'm there half of that time. Yes.
How long has the UPK been in place?
13 years now.
All right. So in 13 years, and I'm glad to see that you have a measurement of success.
Yes.
In 13 years, you have now seen children that have been involved in the program, gone through kindergarten, up and through third grade, fourth grade, fifth grade, almost to graduation. So how is the level of success there? How is the third grade reading guarantee and different benchmarks that along the way, how did capturing those children at a 3- and 4-year-old age? And I understand, of course, there's successful in kindergarten, but how is the rest of the measurement?
So we have been able to look at kindergarten entrance and third grade reading. You have to, we've started with only 1,000 children, and then there's drop-offs. So you need to accumulate over a number of years and test change, et cetera. So just, no, not for excuses, just by way of explanation. So what I can tell you from the latest study that was conducted, this was actually a study, we were able to use federal dollars to pay for this study because we were examining a pay for success approach, which did not produce a pay for success plan for the project, but did allow us to do this very rigorous study. So 66% of the children who had been in UPK for 18 months or more were on track, considered on track for language and literacy at kindergarten. And we compared them to children from similar backgrounds, a lot of controlled all of the background variables that you might think could account for a difference, to children who attended the same amount of preschool in a high quality, I want to emphasize that, so high quality but not UPK site. So it's a very conservative comparison. So 47% of those children were on track compared to 66% in UPK. And we did the comparison to kids in high quality for a couple reasons. First, I can tell you that when we tried to find those children who had stayed that long in low quality, they don't stay that long. So you couldn't even come up with a sample. But the second thing is that UPK's model is built on high quality. And we say we can take high quality, as the state defines it, 3 to 5 stars in their rating system, and we can bring the quality higher. So if we're not showing a difference from how kids perform coming out of high quality, then why would you be doing UPK? So that's why we did that comparison. Then we also looked at the social foundations part of the kindergarten readiness assessment, and children from UPK scored 7 points higher on that. What was interesting was that change, that comparison, it was all among the boys. So the girls didn't look a lot different if they went to high quality versus UPK, but the boys got a lot of additional benefit from being in a UPK site in terms of social emotional development. In some ways, I'm not surprised by that because we have done, with Starting Point as our lead, a lot of work on helping mostly women who are preschool teachers understand boys are different. Boys needs to move. We call it wired to move. And so I think it's showing up in that statistic. You asked about third grade reading. So UPK children scored a third of a standard deviation higher on the third grade reading proficiency assessments than, again, children who had been in regular high quality UPK programs. So I hope that helps.
Yeah, I guess I'm just curious about the learning curve as a child gets older. Mm-hmm. I would suspect that a 3-year-old and a 4-year-old that has a high quality, as you give them in the UPK program, would do well in kindergarten. Does that sustain them when they start advancing? Mm-hmm. Does it sustain them in the third grade? Does it sustain them in math and social studies and going on to middle school and high school? How long, what kind of investment are we making with these children as they get older?
Yeah, so I would say a couple of things. This is not an inoculation against all the rest of the challenges that child may face. It's a solid foundation that will allow them to, we think, continue to achieve well, but it's not a claim that no matter what you throw at this child, poor schools, adverse experiences, that UPK is some sort of a magic pill that they won't be affected by. But the studies show, actually long term, that the greatest benefits from these high quality programs are not necessarily academic, but they're very important nonetheless. And they are staying out of criminal justice system, completing high school, being able to hold down a job, what we call soft skills, but I think everyone has come to now understand executive functioning, so that long term, it means you're a more productive citizen, not necessarily always measured in academics, but in real life outcomes. So those big numbers you've heard on return on investment, they're coming from studies of real adults who've showed those kinds of better outcomes from being in high-quality programs. But we do think it's important that children don't start behind. We want them to start ahead. Is it important for them to go to high-quality schools? Absolutely. So you can continue to build on success instead of remediating.
Yeah, right. And I agree with
Yes.
all that. I'm just curious, after 13 years, if you find that the remediation piece has diminished, that you find that these long-term goals, as you just laid out, has been a reality, that we don't only concentrate on the 3 and 4-year-olds being prepared for kindergarten, and then we lose track of them as they go up the system.
We will continue to and this is all research from our team at Case Western Reserve, so we certainly are continuing to the best of their ability to follow those kids through school. There are various challenges. You have to find the kids in these data sets because you have to find assessments that are given across the board, so you have a sample size that's big enough, and then we'll look to see what's going on with high school, etc. So I won't lie to you, there are challenges, but it's certainly the fact that we have the child data system at Case, which is, again, an unbelievable resource for our community. It allows us to at least consider that we will follow them longitudinally.
Okay, thank you.
So, Director, can you give us a rough breakdown of the 18 plus million? What it's spent for? How much is spent for tuition? How much is spent for the consulting work we do with the providers to increase quality? How much of it is for non-direct education, like the early visiting and the early childhood mental health? Can you kind of break it out for us?
So go through the whole budget in a way and break it out for you. So in terms of our home visiting, it is approximately $1.4 million a year. Early childhood mental health is $669,552. We break out the home visiting in different ways. There's another $1 million spent on the Moms First program, and $125,000 is for the child fatality review process. Within our quality child care budget, we have approximately $5 million, which is spent on sort of generally helping improve quality with all providers, not UPK. We have about $8 million that goes directly to UPK providers, and about $2 million to the training and technical assistance aspects of UPK. And in our budget, about $1 million is the administrative services, personnel, and controlled expenses. Is that
okay?
Is that helping?
That's helpful.
Okay, sure. And we could give you Sonia, who's our business manager, who I alluded to before, has done we have a full breakout of this in our, she took the numbers we got and made it very specific. So that's why I was sort of looking at a lot of numbers, trying to add them together. So if you find that helpful, we can provide that to you in a more detail. Would that be helpful to you?
That would be good.
Okay.
This was a good overview. Thank you.
We'll do that.
And Director, how much money is remaining in the private assistance fund?
For UPK.
Right.
Yes, okay. I had that paper out and where did I put it? So to date, we have spent, of the public dollars, we've spent 4.1 million of the 10 million. Of the private, about 4.3 million. The total private that was pledged is 13.1 million.
Okay, so for the private money, we spent 4.3 million of 13.1, and of the public money, we spent 4.1 of 10.
Correct.
Okay. And we currently have how many children in the program?
Well, it does fluctuate. It's once we get to full capacity, we are well over 4,000, and we've gone as high as 4,600 when we've gotten to full enrollment, which I'm happy to say we've gotten up to over 90% enrollment in the past year. So,
and am I correct that the strongest benefits are shown in the at-risk children?
Yes, absolutely. You may remember Art Rolnick, economist who's done a lot of the studies, was here and addressed you a couple years ago when he was our annual meeting speaker. He is one of the most. He actually, when I called him and asked him if he would come and speak, and he heard that we had a universal pre-kindergarten program, he says, "You may not want me to come because he's an economist. He's looked at the numbers, and he firmly believes we should target kids at a disadvantage because that's where you see the most improvement in skills, and that it's the best investment." I said, no, that's exactly what we're doing. We are looking to target the kids who need this the most, and we're seeing the greatest benefit that way. Absolutely.
So my question is, as I understand it, we have somewhere between 25 and 30,000 children who would be in the 3 to 4 year old age range at any given time, and we currently have 4,600 slots. My question is that the right target number? Is that enough slots to serve most or all of the children that are at risk, that are willing to be served, or is it not enough, or is it more than enough?
I think when we've talked about going to scale in the past. We've talked about getting to 15,000 kids, sort of roughly triple the number of children in the program now. Obviously, the dollars the price tag that goes with that can seem daunting, but that's the number that we've...
15,000.
About
Okay.
15,000, yeah.
Okay. Other questions? Councilman Gallagher.
Hi. When this was first proposed and rolled out, there was a promise of 100 million private. Where are we at on that?
I think that there were hopes of raising enough dollars for in perpetuity. I think as the fundraising started, that number got revised way down to matching the 10 million public dollars, and then we exceeded that, and there hasn't been the same kind of. So I think that goal was put by the wayside, and a more realistic goal was to match the 10 million public dollars.
Yeah, it was used as a basis to move forward on this. So it wasn't a goal, it was a promise. That's why I said the word promise. So as many promises go, thank you.
So, Director, maybe not 100 million, but are we planning to ask for additional private dollars to try to put more money into that fund and reduce what the county would have to do to achieve sustainability?
So 1 million of the 13.1 million that I mentioned before is actually a second grant that I applied for and we did get from KeyBank. So that was an additional million. A number of some of the funds are coming from foundations. And so I think there may be an appetite for them to, once we do spend through their dollars, because the foundation dollars were fairly targeted on certain aspects of the program, so we have to be very good stewards of how we spend it, that they may have some appetite for additional grants. But of course, there was also the additional 10 million public dollars that would be under your control. And some of the private dollars were, I think, one-time asks of individuals, corporations, et cetera. I don't know what the appetite would be there.
Any other questions on early childhood? Okay, thank you very much.
Thank you.
And we need a 10-minute break for refreshment, and we're going to come back at 3:05. Thanks very much. We're in recess.